Welcome to Nurse Pro. This is a channel we want to help you to pass your OSCE. This is a test that you need to complete before you get the nursing license in UK. So, this video we are talking about the overview of the OSCE. Hope that you all will understand much more about the OSCE exam after the video. Actually, there are different types of OSCE exams, and some are for physician and some are for nursing. And in my channel, I'm focusing on the nursing part. And I'm going to talk about the adults 10 stations for general nursing. And actually, there are some stations about the pediatrics and mental station, but I'm talking about the adults 10 stations. So, what is the adult 10 station of OSCE? First of all, we got the A-Pine station. It is already occupied 4 stations in the OSCE exam. There are assessment, planning, implementation, and evaluation. So generally speaking, you will be given a scenario and you will have a actor or a mannequin that you need to ask questions about their daily living, and as well as you need to do the vital signs for the patient. And then you need to identify the important nursing need for that patient, so you need to write it down in the planning section. And for the third one, implementation, you need to give medication to the patient. And then the fourth one, the evaluation, is the verbal handover. Then, after these 4 stations, we will come to have the 4 skill stations. You'll be given around 20 stations that you need to remember all the steps and all the key points in each stations. Then, you need to demonstrate the whole nursing procedure and together with your professional behavior. After these 4 stations, then you need to do the professional value station. Actually, this is something related to the content of code. You got a lot of points that you need to remember for different scenarios. Then, within the given time period, you need to write them down. And then for the last one is the evidence-based practice. You will be given an article related to the evidence-based practice. Then you need to do some kind of paraphrasing, and then you rewrite it again. And then to show that, maybe you need to explain it to your patients, so you need to paraphrase it. And also you need to fit the evidence-based practice to the scenario. So first I would like to talk about the A-Pine station. For the assessment part, you will be given a patient. As I mentioned before, it could be an actor or it is a mannequin. Then you need to do the complete vital signs for the patient. You need to do all the vital signs, just such as the blood pressure, pulse monitoring, temperature, the respiration, and the oxygen saturation. Other than that, you need to complete the ADL assessment. You need to ask quite a lot of questions about the patients to understand and to pick up the nursing need of these patients. And also, you need to pick up the most major nursing needs for the patients. For example, the patients may have different types of problems and with different severity. Then you need to pick up the most severe things that you need to work on it, and then you need to formulate a care plan in the next section. Because there are different types of scenario that you may be encountering, some extra things that you may need to do within these stages. For example, the neuro observation, the nutritional assessment, and as well as the depression assessment. After that, we go to the care planning station. So, as I mentioned before, during the assessment station, you have identified 2 nursing needs and which are the most severe one that you have identified. After that, you need to formulate a care plan for the patient. Such as the usual care plan, you need to identify the problems of it, and then what's your aim. And also, you need to write the nursing interventions for the specific care plan for the patient. And then, next we need to do the 3rd station is the implementation. It is actually the administration of medication. It could be in hospital settings or in the community settings. So, you need to be familiar with both types of medication record, so that when you are given the medication, within the limited time period, you do it precisely, accurately, without any error. And for the next one is the evaluation. This is actually an oral handover. So we need to use a framework for handing over. And this framework is the S-bar format. And actually, it is the situation, background, assessment, and recommendation. And each of them, you got some points that you need to highlight so that you can fully hand over these patients to the other nurses or other healthcare worker. Then we come to the skill stations. So you will be given, you can prepare for it. There are around 20 stations that you need to prepare it. So for these skill stations, I have categorized them into different types so that you can understand it better. For example, some of them are related to the medication administration. So it could be the inhaler medication, it could be the suppository, and also you may need to demonstrate the skills for the intramuscular injection, for the subcutaneous injection. And for the number 5, you can see the intravenous flush and the visual infusion phlebitis assessment. Actually, you need to give the saline flush for the patient, but at the same time, before you give it, you need to ensure that the IV cannula is working well, without any problem, without any phlebitis. That's why you need to do the assessment for the patient's IV cannula. You need to do it according to the VIP scale, the visual infusion phlebitis scale, and then you need to rank, you need to give the correct VIP score, and also you need to respond accordingly. And the number 6 is the oxygen therapy. You need to give oxygen to the patient. Because oxygen is actually a type of medication, that's why you need to get the prescription from the doctor before you give it. For the next one, the main title is the procedure. There are a lot of procedural skill stations that you need to do it. For example, the aseptic non-touch technique, this is actually dressing. You do a dressing for the patients. But do aware that you need to be 100% aseptic. Do not touch any area that will make you contaminate the whole procedure. So the first one is a dressing, and the number 2 is the blood glucose monitoring. Besides you take the blood sugar level for the patients, you also need to respond to the finding that you have obtained. And the number 3 is nasopharyngeal suctioning, and then the fine bore nasal gastric tube insertion. And number 5, in-hospital resuscitation is just like the basic life support for the patients, but it happened in the hospital, so that you need to be familiar with all the guidelines and steps that you need to do during the resuscitation of the patients within the hospital area. And then number 6 is the peak flow rate, and then you have the catheter specimen of urine, and then midstream specimen of urine and analysis. For this one, you need to educate the patients how to save the midstream urine correctly, and then you need to do the urinalysis for the patients. You also need to explain the findings to the patients and any follow-up needed. And the last one is the removal of urinary catheter. Next, some stations that require you to do some assessment. For example, you need to assess the pain, assess the wound condition, or assess the nutritional status of the patient. And then some stations is related to the care planning. For example, the bioassessment. You may be given a photo showing the bowel types of it, and then you need to understand the Bristol stool assessment, and then you need to give the care planning for this patient. And then for the oral care plan, you will be given a scenario. You need to understand this type of patients and what kinds of oral planning intervention is needed for this patient. And the next one is the written task, the fluid balance. This is actually asking you to calculate the input and output, but you need to do it correctly, precisely within a limited time period. And then the last one is the pressure area assessment. For these stations, you need to identify the patient's rating score, and then also you need to identify the major area that is prone to having the pressure sore, and also the sign of pressure sores. You need to list them out. So then, the next stations is the professional values. For the professional values, you need to memorize a lot of points. So you'll be given a scenario, and then you need to write down what you remember. Also need to match it with your scenarios. There are the list of topics. For example, bullying, concealment of bad status, confidentiality, drug error, false representation, falsifying observations, falsifying timesheets, hospital food, impaired performance, laboratory results, possible abuse, professional confrontation, racism, social media, and witness abuse. Actually, you got all the points in your marking scheme, but you need to memorize them hard. And the next and the last one is the evidence-based practice. You will be given a scenario, a passage. This is maybe a journal. Then you may need to paraphrase it and then you write it down. Tell your patients more information about a certain topics. That's why you need to rephrase it after you read it. But there are certain topics that you will be given. There are ankle sprain, autism spectrum disorder, bedside handover, cervical screening, cranberry juice and urinary tract infections, dementia and music, diabetes, female myocardial infarction, fever in children, pressure ulcer prevention, restraint, saline versus take water, smoking cessation, use of honey dressing for venous leg ulcers. Actually, you got all the points in your marking scheme. You need to read through it, you need to memorize it, and then during your scenario, you need to rephrase and then write them out. Yep, these are all the 10 stations of the adult nursing 10 stations. So I hope after this video, you'll understand more about the OSCE exam. And with a specific learning method, then you could pass your exam more easily. So I hope this video is useful to all of you. At the same time, please watch other videos to prepare your exam. Thank you for watching and see you in the next video. Goodbye!